1,000 new cases were announced yesterday, and we're seeing the numbers keep going up. Is this a result of more testing, or are you seeing any alarming trends connected with these new cases?
Well, certainly there's a trend here, and we are doing a lot more testing. We've ramped up. However, we're seeing COVID-19 spreading across our state, and it is alarming. We know what it takes to get these numbers down. It takes scrupulous hand washing and physical distancing and mask wearing. The sad part of this moment is that we still, 8 months in, don't have a national strategy. And so it's on states to show the leadership. And we have done it before. We need our residents to double down on what it takes so we can keep our economy engaged, get our kids in school. But with these numbers rising, and if this trajectory holds, it's going to have to mandate the possibility of taking steps backwards. And none of us wants to do that again.
And Governor, you had mentioned that just taking some steps backward. A lot of folks are concerned that possibly the numbers are going to lead to another state shutdown. Is that something that we could possibly see? And with the Supreme Court's ruling against your executive powers, is that something that you would be able to do?
Well, let me start with this. COVID-19 hasn't changed. It is still a very real threat all across the state of Michigan. And it doesn't care about a Supreme Court ruling. It doesn't care about the legislature's schedule. It doesn't care what side of the aisle people are going to vote on. It is still a real threat. And it's a threat to our lives. It's a threat to our livelihoods. It's a threat to our economy and to our businesses alike. And that's why we've got to take this seriously. If we get overwhelmed and we've got hospitals that are on the verge of being overrun, then we will have to take steps backward. And there are epidemic orders in the Department of Health and Human Services that the director can use. But I want to avoid that. We want to avoid that and do everything we can to not have to take steps backward. And that's why I'm calling on the people of Michigan. I'm calling on the Trump administration. Wear the masks. Tell people what it's going to take. Let's get the politics out of this, because this is about our public health. And 8 months in, we are still in the danger zone in this country.
So, Governor, it's clear that hospitalizations, the numbers of people being in the hospital really is going to dictate whether we're going to see another shutdown. So where are we right now in hospitalizations? Are we at max capacity or nearing there at all?
Well, a number of CEOs of our health systems have sent a letter urging that we all double down on masking right now, because they are concerned about what the trajectory means. When we have positive tests, it's usually a lagging indicator. Hospitalizations is 2-3 weeks later. And so these numbers, posting almost 3,500 cases yesterday, is by far the highest number we've seen in Michigan in 8 months of dealing with this. And that's why the hospital leaders are getting very concerned, as am I. And that's why every one of us should be as well. We're barreling in toward the holiday season, the flu season. We've got more contacts than ever. And that's why we have to mask up. We have to not pull together like we want to in terms of gathering. Let's pull together figuratively so that we can pull together literally after we get our arms around this virus.
And Governor, a lot of people are asking on social media, there is a mask mandate in place. So why are we seeing the numbers going up? Are you thinking that people are being a little more relaxed and not wearing masks, or is there something else?
Well, Simon, we've been at this for a long time and we're all tired of it. Trust me, I am tired of this. But the fact of the matter is, despite this Supreme Court decision that has created a lot of confusion and the legislature that has brought a lot of lawsuits, the fact of the matter is we still have a mask mandate. And I want people to hear that loud and clear. The epidemic orders from the Department of Health and Human Service have the force of law. We are still in the midst of a pandemic. The mask mandate is in effect, and people need to understand that, but also heed that. Let's keep each other safe. Let's keep our economy open, and let's push these numbers down. It's a very serious moment.
Let's talk about the election. President Trump will be in Lansing later this week. He hosts a lot of rallies with lots of folks there not wearing masks and not social distancing. Are you concerned about that? And leading up to the election, are we safe to walk into the polls and to cast our ballot right now?
Well, I am concerned about it, Simon. The president has shown that he can't even protect his own self from getting COVID, and now the vice president's top people have COVID. This is a disease that is still very present. And so coming together and bringing groups who are not wearing masks, where they are projecting their voices, this is a recipe for disaster. And we have seen COVID outbreaks as a result of these rallies. I'm encouraging Michigan citizens, don't attend events like this. You can vote. Vote. I want you to vote, and I want you to be safe when you go vote, and you will be. Wear your mask. Bring your ID. Try to vote early if you can. You can vote tomorrow in most clerk's offices across the state of Michigan. But the fact of the matter is, I'm never going to tell you how to vote, but I can tell you if we had an administration that had a national strategy, which is what Joe Biden and Kamala Harris bring to the table, if we had a legislature that was going to work with me to bolster the work that we can do to protect people, I think that our economy will suffer less and certainly will save a lot of lives.
All right, Governor Gretchen Whitmer, thank you so much for joining us this morning.
Thank you.